Hello. My name is Jones, and today we are going to look at phobias. A phobia is an anxiety disorder that is characterized by obsessive, irrational, and intense fear of a specific object, or physical situation. A phobia is an anxiety disorder that is characterized by obsessive, irrational, and intense fear of specific object, an activity or physical situation. So in a phobia, you have an irrational, intense fear of specific object or an activity or physical situation. So the fear, which is out of proportion to reality, usually results from early painful or unpleasant experiences involving particular object or situation. A phobia may arise from displacing an unconscious conflict on an object that is symbolically related. So some phobias that are out there include the fear of tall trees, which is known as bathyphobia. Tall trees, bathyphobia. Then the fear of bridges, that is gyphlophobia. The fear of bridges, that is gyphlophobia. Then the fear of spiders, arachnophobia. That's a fear of spiders. The fear of vomiting, from emesis, emetophobia. So that is the fear of vomiting, emetophobia. Then fear of snakes, that is ophidiophobia. Ophidiophobia, that is fear of snakes. Then triskaidekaphobia, that is the fear of the number 13. Triskaidekaphobia, that is fear of the number 13. Friday the 13th. So we have triskaidekaphobia. So that is the fear of the number 13. Triskaidekaphobia. Triskaidekaphobia. So that is the fear of the number 13. So agoraphobia, fear of being in places or situations from which escape may be difficult or help may not be readily available. Agoraphobia, fear of being in places or open places or situations in which escape may be difficult or may not be readily available. Then we have sociophobia, also called social anxiety disorder. It is characterized by persistent fear of appearing shameful, stupid, or inept in the presence of others. That is sociophobia or social anxiety disorder. Fear of appearing stupid or inept in the presence of others. Then there is specific phobia, also called simple phobia, a persistent fear of a specific object or situation, other than of two phobia mentioned that we have mentioned necessarily in our earlier discussion. So there are subcategories here when we're talking about specific phobias, that is injured blood injection or situational, natural environment or animals or other to do with fear of costumed character or space. That is for the specific phobia. So these are some of the categories, that is the injury of blood or injection or situational, or natural environment, animals or others. So some risk factors to phobias. There is the learning theory that gives some of the risk factors. There's the cognitive theory that tries to give some of the risk factors, and the life experience part. So on the learning theory, here as one of the risk factors, the belief that phobias are learned and become conditioned responses when the client needs to escape an uncomfortable situation make the learning theory a good proposal as to one of the causes of phobia. So what necessarily someone has learned to be painful, okay, uncomfortable in the past, will make them to develop phobia against such things. So the learning theory puts forward that the belief that phobias are learned and become conditioned response when the client needs to escape an uncomfortable situation. So the risk factor is that someone has learned of that thing, okay, in that they are phobias with phobias about. So it will make them to behave in a certain way. Then there is the cognitive aspect theory to explaining phobias, or the cognitive theory. Here, phobias are produced by anxiety-inducing self-instructions of 40 cognition. Okay, so where you end up judging a stethoscope to be a snake. So cognitively, there is 40 cognition. Then life experiences, certain life experiences such as traumatic events may set the stage for phobias later in life. So some of the risk factors to phobia is that someone might have learned, okay, to be uncomfortable with something. So there is a learning theory to that. Then there is a cognitive theory to do with 40 cognition, and then there's life experience. Okay, so that is LC, the life experience, learning theory, and the cognitive theory. Okay, as some of the theories that are put forward for phobias. What are some of the signs and symptoms of phobia? Withdrawal, high level of anxiety, inability to function and meet self-care needs, inappropriate behavior that is used to avoid the feared situation, object, or activity. Then the other one is dysfunctional social interactions and relationships. Okay, so these are some of the signs and symptoms: withdrawal, high levels of anxiety, inability to function, inappropriate behavior, okay, in avoiding the feared situation, object, or activity, and then dysfunctional social interaction. Okay, some of the nesting problems, okay, that can be turned into diagnosis include anxiety, powerlessness, ineffective individual coping, impaired verbal communication, altered thought processes, self-esteem disturbances, impaired social interaction, and risk of injury. Okay, as this person may end up to try to jump from one place to the other, so there's that risk of injury. Okay, so in the therapeutic nursing management here, systematic desensitization is important, okay, in order to avoid phobia. This process of systematic or gradual exposure to phobic object or situation is aimed at decreasing the fear and increasing the ability to function in the presence of the phobic stimulus. So there you have it. Today we have been looking at phobias. A phobia is an anxiety that is disorder which is characterized by obsessive, irrational, and intensive fear of a specific object, an activity, or physical situation. Okay, the fear that we see in phobia is out of proportion to reality, usually resulting from early painful or unpleasant experiences. Okay, that is involving the object or situation. So phobias may arise from displacing unconscious conflicts on an object that is symbolically related. So there is fear of tall objects, there is fear of bridges, there is fear of spiders, there is fear of vomiting, there is a fear of snakes, and fear of number 13. Okay, so we have talked about those types of phobia, and also we talked about other types of phobia like agoraphobia, social phobia, and specific phobia, okay, which is also called simple phobia. Then on the risk factors, we have said that there is the learning theory that is put forward as one of the risk factors. Here, the belief that phobias are learned okay, and but one become conditioned, okay, to respond in a certain way to escape the uncomfortable situation. Then there's the cognitive theory that is pushed forward as one of the risk factors to phobias, okay, where there's faulty cognition. Then there's life experience, okay. Then signs and symptoms included, the signs and symptoms that we have talked about includes withdrawal, high level of anxiety, inability to function, inappropriate behavior, and a functional social interaction. Then some of the nursing problems that we can identify or nursing diagnosis that we can make may range from anxiety, powerlessness, okay, which may be taken as self-care deficit, okay. Then it's ineffective individual coping, impaired verbal communication, altered thought process, self-esteem disturbance, impaired social interaction, and risk of injury, okay. So to make them as nursing diagnosis, say due to, related to, and the likes. But otherwise, the therapeutic nursing management of this includes systemic desensitization and all that to allow the individual ability to function in the presence of who? The phobic stimulus. So from me, I say thank you and I keep studying.